In the world of ABA and autism, there are often ethical dilemmas that come up. Today, we're covering some mistakes behavior analysts make when working with parents. Hi, I'm Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So today we are sharing a small excerpt from podcast 232 with Dr. Amanda Kelly, otherwise known as Behavior Babe, talking about ethical dilemmas parents and professionals face.
All right, mistake number one. Let me start by saying that these are mistakes in other professions that other professionals could make, but I'm a behavior analyst and an educator by training. So I'm going to speak from that perspective, and I'm going to speak about the profession that I currently represent. I think it is really comes down to our language, the way in which we communicate. This could be the words we're using, like the word punishment. The word punishment in the field of behavior analysis means to decrease, literally means to decrease. But if we say to a parent like, oh, I'm going to put a punishment procedure in place, that doesn't translate well. And it's not exactly what we are actually trying to say. And ethically speaking, we would put reinforcement procedures in place first. But I wanted to pick something that has one definition to the rest of the world and a different one for us as analysts. Another thing that I see people doing is they will use the jargon words almost like real words and really do think because we've used them so much that they are real words. For example, manding comes from the word mand, comes from demand, command, reprimand is my understanding there for Skinner's verbal behavior. But when we say to parents, oh, he was doing some great manding today, I don't know what that means necessarily, especially if I'm entering new into the services or into the relationship. Why don't we say things like, we're really going to find what motivates your child and help them get the words or the ways to get what they really want in their life. And today that went so well. By the way, we call that manding, if we even need to give them the language for it, which can be helpful when families want to search information on their own or look at any of the evidence that we might be finding. Okay, great, that's the term. But why are we talking like that? And why is it written that way in reports and treatment plans? I know from my own histories, Mary, I would write, behavior assessments, FBAs. And even when I put in the word antecedent into a professional report, I would put events that come before the behavior. So at least there's the definition and the context. Because if people can't understand what we're saying, then it doesn't matter how amazing the advice is that we have or the information that we could provide them. So I think the very first one is the jargon and the language. And I would add to that, it's also the way in which we deliver the information. So if we say to you like, oh, I'm going to find things that are really motivating to your child, and then you don't have a lot of confidence in what I'm saying because of how quietly I'm saying it or how unsure I am in saying it. So analysts out there who are listening, practice this. Talk to people in your life, explain to them the procedures that you might work with a client on, and try to explain it without using behavior analytic terms. I remember when I was doing my graduate degree, we spent semesters learning how to be professionally precise and accurate, where I thought, all I'm going to do is publish scientific studies at this point, because that's the only person. Even then, I don't even know if my colleagues would understand that level of jargon I was trained towards. And then I remember in the second to the last semester, they swung us back and wouldn't allow us to use any of the technical jargon. And everything had to be in everyday speech. And I remember getting frustrated. And I said, this is not fair. You just trained me to do this. And they say, that's great. We taught you to think like a scientist, but we need you to speak in a way so anyone could understand. And I'm just so grateful for that experience.
Yeah. I think because of my nursing background, actually, I feel like I'm particularly good at that, at translating, because the medical doctors would give, or the radiologist would give really scary kind of big language. And then I considered it my role as a nurse to, try to explain it in layman's terms. And and when training individuals, my dissertation's on training, and I've always trained even new nurses. I was in charge of like staff development for a year or two. And it's like new people, whether they're parents or new professionals, they need it to make sense right away. And I feel like, my books are probably among the best in terms of really saying things in layman's terms, and even my courses, and the fact that parents and professionals are together in my courses and communities, we right away just dive into making it as simple as possible, and not just terms, acronyms. I feel like every time I have somebody on the show, a behavior analyst, for instance, a whole lot of acronyms get thrown out there. So I'm always like, I haven't had to do that with you, Amanda, because you're so good at it too. But like, okay, wait, BIP, FBA, ABA, IEP, just all these acronyms that we use that are overwhelming.
I was laughing and smiling as you're saying about these acronyms, and also about people who are learning the science or learning how to implement it, not just caregivers and parents, but professionals entering. I was bought in because I saw the effects. Then I went to school and was like, oh, okay, stimulus equivalent. Okay, cool. Oh, you mean that's what I did when he did that? Okay, got it. So it was really connecting it to experiences, connecting it to outcomes, and giving those names and labels. I do recognize that for some of my graduate students, they are entering directly into the program, maybe without some years of experience, or they're getting it simultaneously if they're in the program. And I'm teaching ethics. It's their first semester. And I have to remember, like, they're learning how to be graduate students. They're being nervous, I'm sure, about how to write research papers, how to look up things. And so a lot of what I do in that class is I don't throw terms at them, and I give them explanations and give them stories, and they go, "Oh yeah, and they're making some of those connections."
Hope you enjoyed that short excerpt. If you did, you can listen to the whole podcast anywhere you listen to podcasts, or check the link below to listen on the website. For more information about how you can join our online course and community, attend a free workshop. We have some new workshops in place, and we have a brand new school age course too that can help kids over the age of 6, as well as our toddler preschooler course for kids under 6. So hope you check out the free workshop at marybarbera.com/workshop, and I will see you right here next time.